The heat in the helicopter was a relentless beast, a suffocating blanket that clung to us with the tenacity of a blood-sucking leech. Our fire-retardant flight suits, designed to protect us from the inferno of a crash, were now our tormentors. The only respite came from the meager trickle of air from the overhead nozzle, or, on rare occasions, the crack of a side window at higher altitudes. Sweat poured down my back like a waterfall, and the helicopter carried an unsettling odor. Perhaps a creature had succumbed to the relentless heat in the hangar. Our pilot's smirk and the ominous words, "Today will be interesting," did little to ease my growing apprehension. Our flight took us 45 minutes south along the lakeshore, then veered inland toward a small, rural hospital. The call, a stark contrast to the serene beauty of the surrounding landscape, was one that no flight crew relished. These cases, a stark reminder of the fragility of life, elicited profound sadness, anxiety, and trepidation, even in the most hardened veterans. The frantic voice on the other end belonged to a lone physician, the sole guardian of life and death in that tiny rural hospital. She juggled multiple patients in the emergency department, shouldered critical care responsibilities, and managed the influx of cases from the local clinic. Earlier, the case began innocuously enough. A young child at daycare was settling in for nap time as usual. The childminder sent the toddlers off to their designated corners of the house, expecting the typical peace of an afternoon siesta. But as she made her rounds, something was off. From beneath one of the blankets came a strange gurgling sound. Pulling the child over, she winced, and the sight caused her blood to drain. He was drenched in vomit, his skin a pale, unsettling gray. Panic surged through her as she dialed for an ambulance. The first responders, local volunteers, arrived swiftly, men and women trained to act in these moments of crisis, even if they weren't entirely steeled for the unfolding horror. They bundled the child into the ambulance and raced to the small emergency department, fighting time itself. The ER doctor on duty, more accustomed to routine checkups at her family practice clinic, felt the weight of the situation crush down on her. This case wasn't just beyond her experience, it was beyond anything previously encountered. The initial assessment was grim. Vomit had likely been inhaled into the lungs, or perhaps he'd choked or suffered a seizure. The exact cause didn't matter at that moment. What mattered was the oxygen saturation plummeting through the floor and the thready, weak pulse. His levels were in the low 60s, a catastrophic drop from normal. The brain, deprived of oxygen and blood flow, was already suffering. Irreparable damage had begun. There was no time to waste. Yet in that suffocating emergency room, time once again declared itself the ultimate master. Hope flickered like a candle in the darkness. Children, with their remarkable capacity for plasticity, could defy the odds. The brain, a resilient organ, could adapt and rewire itself in the face of injury. Damaged areas could be assumed by other regions, restoring lost functions. This child, like others before him, held the promise of recovery despite the severity of the trauma. Relief washed over the faces of the ED staff as our flight crew entered the room. Working with limited resources, the lone physician had done an admirable job stabilizing the child. Lying pristine on an ER cot, intubated and ventilated with a bag valve mask device, he was pale and struggling to live. Given the passage of time and the absence of parental figures, a sense of gritty unease settled over the room. The mother, a solitary figure working in a nearby town, raced toward her child, driven by a frantic desperation. Informed only of her child's grave illness, she arrived, her heart pounding in her chest and fresh tears bouncing on the scuffed ER tile floor. As we prepared to load the child onto our stretcher, the mother burst into the ED, her screams piercing the air. "Where's my baby?" she demanded, her voice a raw, anguished cry. I found myself in the unenviable position of delivering a devastating truth. In the face of such horror, disbelief and denial were typical responses. "No, it can't be," the mother insisted, her voice a desperate plea. "He looks like he's just sleeping." I reassured her of our unwavering efforts, explaining the urgency of our departure, and transporting the child to the pediatric ICU. Moving with precision, our crew continued to monitor the child and provide life-sustaining ventilation. The nursing staff escorted the mother to the side of the helicopter, her face etched with a mixture of grief and hope. Goosebumps rose on my arms as she leaned down, a final heartbreaking kiss for her child. We promised the mother, our voices heavy with the gravity of our duty, that we would care for her child as if he were our own. The nurse paramedic's gaze met mine as the Sikorsky's engine spooled to a whine. We were awash in a mixture of sadness and frustration, reflecting the direness of the situation. "What are we going to do for this kid?" she asked, her voice filled with a raw, unbridled fear. "We will do what we've always done," I replied, my voice crackling in the headset. "We'll provide the best care possible, relying on our skills, faith, and the higher power to guide us. That's all we have today." Our precious cargo was secured. The pilot engaged the rotors and we began our ascent. Once again, the familiar stench, a pungent reminder of the grim reality we faced, invaded the cockpit. The humidity, an unusual intruder in this region, clung to us like a suffocating blanket. The temperature, well into the upper 90s, pushed the helicopter's limits. Hovering at 15 feet in the dense humidity, we were trapped in limbo, not of our choosing. The pilot's voice, laced with a hint of desperation, suggested that we burn off some fuel weight, hoping to gain enough altitude to continue the flight. Our backup helicopter, a silent sentinel in the base hangar, awaited essential repair parts. The hospital's isolated location, a remote outpost on the edge of civilization, made the prospect of a ground ambulance daunting. Hours of travel over rough gravel roads would pose a significant risk to our fragile passenger. An eternity, or perhaps a mere 10 minutes, passed before the futility of our situation became undeniable. The pilot, his voice heavy with defeat, guided the helicopter back to the ground. We radioed for an ambulance, a stark reminder of the limitations of our aerial capabilities. I was silently grateful that the mother had already left for the trauma center, her maternal instinct driving her frantically to be with her child. Hours seemed to crawl by as we waited for the ambulance. The child's condition deteriorated, a relentless decline that mirrored the fading light of hope. We established another IV, continued the antibiotic therapy initiated in the emergency department, and watched helplessly as the oxygen saturation plummeted. The child's body, overwhelmed by the insult to his lungs, was fighting a losing battle. Our options were limited, our efforts focused on providing support and praying for a miracle. At that stage in my life, parenthood was a future I eagerly anticipated. Yet I could feel the depth of the mother's pain, the raw anguish reflected in my partner's eyes. Our hearts ached for our own loved ones who awaited us at home. As we navigated the treacherous rural roads, we took turns holding the child's hand, offering a silent, comforting presence in the face of impending darkness. Emergency physicians and flight crews are masters of adaptation, wizards at navigating the unpredictable chaos of our profession. We are troubleshooting experts capable of solving complex problems with swift efficiency. Critical care demands quick thinking and decisive action. Yet, even for us, some moments defy all bounds of knowledge and skill. This situation, a humbling reminder of our limitations, was one such moment. Time, our relentless, ever-present enemy, had turned against us, making us victims of an unforeseen helicopter malfunction. Despite meticulous planning and unwavering effort, things can and will go wrong. The consequences, when they strike, can be devastating. The child's condition deteriorated as we jolted along the rough roads, our hopes pinned on reaching the blacktop highway, allowing acceleration to max speed. The child's oxygen saturation plummeted, and cardiac arrhythmias began to appear on the monitor. Without the aid of laboratory tests and X-rays, we relied on our experience and a glimmer of hope as we implemented various interventions. Fate, however, had other plans. We burst through the trauma bay doors, taking a shortcut to the pediatric ICU elevators. The PICU fellow and attending physician, their brows furrowed in concern, shared our grave outlook. The elevator doors slid open, and a team of compassionate nurses enveloped the child and joined the battle for survival. The cold blanket of reality wrapped the ICU team as the child's mother, escorted by a social worker, rushed towards the team. No matter the level of expertise, some illnesses are beyond our rescue. The day ended, and another chapter closed, leaving a deep scar on our souls.